The majority of people come in for rhinoplasty, their main concern is that their nose doesn't fit their face. The best reasons why people get their nose fixed is when they have an identifiable problem. Something that they can point to and identify and say, listen, Dr. Cruz, can you take care of this hump? Can you make my nose a little narrower? Can you define my tip a little bit more? Those are all definable things. What they come to me for is to create harmony within their face. They'll tell me that their nose is too big, too long, too wide, and these are all things that can be taken care of with surgery, but my job is to make sure that the nose fits the face.
My name is Stephanie, and today I met with Dr. Cruz and considering rhinoplasty. I'm considering having my nose done because I look at my face and I'm like, you know what, that can be corrected.
The reason why Stephanie is such a good candidate is because she's inherently very pretty. But the problem that Stephanie has is that her nose is so disproportionately large compared to her face that the person who's looking at her is distracted by her nose. What I have to do during the surgery is to reduce the size of the nose so that you can get past the nose and look at how pretty her eyes are and how pretty her facial skeleton is. The type of nose that fits a patient is really individualized, and that's part of the art of being a plastic surgeon, especially if you do a lot of noses, because certainly not all noses are the same, and nor should you have the same nose on every person. You have to base it on whether they're a man or a woman, and plus their ethnicity. You're not going to make an Asian nose the same as a Caucasian nose. Plus, a lot of it is, what does the patient want? I believe it would be a mistake to give Stephanie a very small nose, and because that wouldn't fit well on her face. It would go against what her ethnicity is. So my job is not only to be able to perform the surgery, but also to be able to help guide the patient along with what will best fit her face. So by making the nose smaller, enlarging the chin, it's going to bring out her cheekbones, it's going to accentuate her eyes, and it's going to give her a triangular face. It's going to be a very powerful result.
This isn't really a big thing. The pain goes away, the bruises go away, and you come out looking more beautiful than you felt before you went into it. I'm so happy that I chose Dr. Cruz for this life-changing experience and for him to help me in so many ways. Now it's on to bigger and better things.
The most significant thing with aging of the nose is not really that the nose grows. People think that the nose gets larger as you get older. That's not true. At least not completely true. What really happens is the nose starts to droop. Literally, like the rest of the face, it starts to fall off its skeletal structure. So as far as aging is concerned, the nose looks like it gets longer with time or with age. And what I do is to just shorten the nose, and it's amazing how much shortening the nose, which is a relatively simple procedure, can make the nose look much younger. The critical thing with nose surgery is really to go to a plastic surgeon that has done a lot of noses, because the nose has so many nuances that it really takes experience to figure out how one nose is going to react over another nose. And I know how a nose is going to react. I've developed techniques to manage most of the problems, most of the common problems that you see with noses. Another thing that I feel that has helped me is that I take care of a lot of secondary noses that have already been done, and these noses are truly the most difficult noses to operate on, because there's a lot of scar tissue, there's things that you have to correct. And if I could comment one thing on nose surgery, is that your first shot is the best shot.